Hello, everyone. My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm here today at our live Patient Prism studios at the Dykema DSO Conference in Denver, Colorado. I'm here with Gary Salman from Black Talon Security, talking today about cybersecurity and the threats that our dental practices and DSOs face on a daily basis as we keep running our practices. So, thank you for coming.
Yeah, pleasure.
Let's start out with thinking about this, because a lot of us don't think about these threats until something bad happens, right? And the cost of reacting to something bad happen is so immense. We've seen examples this year of practices being shut for a month,
Right.
from ransomware, malware, viruses, all sorts of stuff. So tell us what's going on in the DSO world today, in the dental world, what's happening in the security world that makes us think about, man, we need to pay attention.
Right. So I think the biggest thing really is the extortion, right? When these practices are being hit with this ransomware, it's not only the shutting down of the systems, right? Because ransomware damages the computers, right? Okay. They install backdoors, the operating systems don't work, the computers may not boot up properly. So you have a business continuity issue, right? So your computers are there, they just don't work properly.
Right.
They're all encrypted with ransomware. But one of the big issues is the theft of the patient data. So the hackers know that businesses are investing a lot of money right now on backup solutions to try and prevent these types of things.
Right.
So what the hackers have done to counter this is when they break into the networks, they will offload all of the patient data, right?
Wow.
All of the records, the x-rays, insurance cards, driver's licenses, you name it. And then what they do is they tell the DSO, they say, hey, you don't want to pay us? Come check out our dark web website. We're starting to leak all your patient data. And then you'll see photos of your patients. You'll see their health history forms. They'll leak like 1 to 10%. And at that point, the DSO is like, wow, we have a major problem right now. We have a PR issue. We have a HIPAA issue. We have state, we have state issues. And to your point, a lot of DSOs don't realize the severity of these types of events until they're a victim. Right, and then all of a sudden it becomes a primary concern and a primary focus of the organization, but unfortunately it's after the fact. But I mean, you had a good point. Some of these organizations that are getting hit now, especially if they're not properly prepared, they're down for weeks. Right?
Down for weeks, absolutely.
And even some of them that are properly prepared, they'll be still down for 10 to 14 business days, right? Because it takes such a tremendous amount of time to bring these systems back up. And the reality is you have to rebuild the computers from scratch. So as a DSO, imagine having to wipe every single computer that's been impacted in your environment.
My goodness.
And a lot of DSOs have all their offices connected nowadays. They strike one physical location, and sometimes within hours, every location gets taken down.
So what do you do, right? What do you do? Obviously, the one solution is wait and then fix it, but that's obviously very expensive from all angles, regulatory angles, state, HIPAA, all sorts of patient, you're going to lose patients, a revenue loss, it's all bad. So you guys come in, and what do you guys do when somebody engages you in terms of, is there an assessment process and and there's recommendations?
Yeah, so I think that's exactly how it works. So one of the most important things is to start with an assessment, right? We don't want to come in and just all of a sudden start throwing all of our tools on the network, right, and assuming they have problems. Sure, we can start with some tools, but what we're going to do first is really get a thorough understanding of the organization. How do they operate? What's their network topography look like? Where's their data? Who has access to the data? What we forget about now is how many systems are connected to our patient data. It's not simply just imaging and not just practice management software.
It's 15 vendors.
That's right. We have text messaging, right? We have billing systems. We have all insurance billing systems, right? Claims, all these different types of interactions across all these databases, and third-party risk is a big problem right now. Hey, you didn't have a breach at your physical DSO, but your vendor had a breach. It's really not that much different. Right?
That is correct.
Yeah, and the doctors, the DSO still owns the breach, right? That's how the HIPAA laws are written. It's still their patients.
It's their patient. So if your vendor got breached, and somehow that's the patient information got transferred or deleted or whatever it was, it's still the doctor's problem.
It is. It's the doctor's, the DSO's problem. So we start with this security risk assessment, which is also required for HIPAA compliance. And then from there, we start deploying our tool sets. And what we're really doing is we're trying to understand what's called their attack surface. you have so many entry points into these networks, and obviously the bigger the DSO you are, the bigger the attack surfaces.
100%.
You have remote employees, right? You have managed service providers, external IT resources. You have IT folks working from home. You get the idea here.
Right.
I would say a majority of the DSOs we work with prior to us coming in, they had no idea what their attack surface looked like.
Okay.
So you have a person, maybe even a practice administrator, he or she's working from home.
Right.
They're sitting behind a cable modem. Their kid's computer is connected to the same network that administrators, that machine gets hit. Then the malware moves from the child's machine to that practice administrator's machine who's connected to VPN, and it goes right into the corporate environment, right?
Wow.
We've seen many ransomware attacks where it started at a doctor's home or an employee's home, but typically a DSO doesn't have that type of visibility. The managed service providers they work with don't have that visibility. So we come in and do what's called vulnerability management, where every couple of hours, really every 4 hours, we're scanning the network and we're looking for those entry points that hackers will exploit to basically walk right into the network.
That's right. And you're shutting those doors.
So that's right. We identify the risk.
Right.
We risk rank it because you can't address everything. There's budgets, there's time, right? Resources. We risk rank the vulnerabilities, and then we work with either the DSO's internal IT team or external and say, hey, here are the risks. Here are the ones that our security folks classify as high risk. You have 2 weeks to fix them, right? And often we'll assist in certain ways with closing those doors. So that's a huge problem right now. So many IT folks still have this concept of, well, every network gets breached because people click on stuff, right? And okay, it's an interesting thought.
Right.
And it is true, a lot of networks are breached because someone makes a mistake. They click on a phishing or a spear phishing email, and they expose the network to malicious code.
Correct.
But they don't think about all these other ways that hackers break in, which is the traditional hacking, where they scan the network without the DSO's permission, find the vulnerabilities, and literally walk right through the front door. So we also have the training platform that educates the doctors and the entire team on phishing and spear phishing and all these other types of methodologies that hackers are using to socially engineer the doctors and employees to giving up access to the network. So between training, vulnerability scanning, we do penetration testing where ethical hackers will try and breach the network.
Right.
You know, they assume the role of a criminal and don't have passwords or anything like that. They're going to use their tool sets and their human intellect to try and breach.
Right.
So we try and approach it from multiple levels.
This sounds, I mean, is this a pricey affair? Does it cost a lot of money, or is it affordable? Obviously, it's pricey when things go wrong.
Right.
From a value standpoint, is it in terms of pricing? Is it per office? Is it number of computers? Is it how do you guys price that?
So we typically, in the dental industry, we typically price it per physical location because most offices have somewhere around 15 to 20 computers.
Okay.
So instead of trying to count every machine that the DSO has, we typically license per physical location, and it's actually not costly. You know, if you look at what you would pay per month, you know, starting at a couple $100 for everything, for all the compliance and security, and access to our what are called CISPs, which are credentialed security engineers. So for a lot of our DSOs, we provide virtual chief information security officer services.
That's fantastic.
Right, because those individuals' salaries are high, and many DSOs, they don't want to float that kind of salary within their org, so they're basically getting a fractional CISO, you know, and they have access to all of our security guys, and you know, we have 26,000 plus computers in the dental industry that we're monitoring, so not only do they have a wealth of information about security, but they know how dental practices function, all the different practice management systems and imaging systems. So we're really specialists in this industry from a security standpoint. I will say one of the biggest problems we see is the DSOs are trying to do security in-house, and they don't have the correct people, right? They're just letting their traditional IT teams do it. Their managed service providers don't have credentialed security folks.
Correct.
But the biggest issue we see is it has to be audited by a third party, right? You can't say, we can check our own security, we know we're good,
That's right.
right? No one does that anymore. But in the dental space, it's a common process where they're checking their own security. And I always say to the executives of DSOs, has anyone ever handed you a report showing you all the vulnerabilities in the areas that your network's going to get hit? And I've yet to really tell anyone to tell me, hey,
that's hard because again, it's a specialized thing.
Right.
You're not like an IT company. You're basically focusing on security and cybersecurity and preventing bad things from happening for your network and your computers and your reputation as well as face all these penalties that
That's right.
could arise. What's the best way? It looks like, and it's super cost effective. I mean, it's not much for a couple $100 for everything for an office. The damage could be in hundreds of thousands of dollars.
Or millions. For most a lot of DSOs, it's millions.
Yeah. Millions.
Yeah.
What's the best way to get a hold of you guys to kind of get a consultation going?
Sure. So they can find us on blacktalonsecurity.com. So all of our information is there. You can contact us. You can also reach us at 800-683-3797. So
this has been wonderful information. I mean, I think it's definitely a threat. And as the economy kind of falters a little bit, we're going to see some more threats coming out, right? Every time there is a recession, every time there is things that are kind of weird, now there is an opportunity for people to do a little bit crazy things.
Yeah.
And I think cybersecurity is going to be, it is the cybercrime is the next frontier. We're seeing that already.
That's right.
Across the world.
You can't ignore it. And to your point, when COVID hit, the ransomware went through the roof because weakness. Right, criminals exploit weakness.
Right.
So now with economic headwinds, we're potentially facing another uphill battle with cyber events. So point well taken.
Thank you so much for this wonderful talk, and I look forward to learning more. And hopefully, most of our clients and whoever is listening to it, please pay attention to this important thing, because it's really hard. Just somebody hacking your email is so painful. Somebody hacking your Facebook is so painful. Imagine them hacking your entire network of patients and everything else. So take notice of this threat and act before it's too late. So thank you so much.
Yeah, you're very welcome. Thank you for having me. Appreciate it.